Nursing assistant exam preparation. Question 1. A resident is on a clear liquid diet. Which of the following is allowed? Option A, milk. Option B, strained cream soup. Option C, apple juice. Option D, oatmeal. The correct answer is option C, apple juice. Clear liquids are those you can see through at room temperature. Apple juice, clear broth, tea, and gelatin are allowed. Question 2. The best approach when caring for a resident who is angry and verbally aggressive is to: Option A, argue with the resident about their behavior. Option B, remain calm, speak softly, and give the resident space. Option C, restrain the resident immediately. Option D, leave the room and refuse to provide care. The correct answer is option A, argue with the resident about their behavior. Remaining calm de-escalates the situation. Allowing space while ensuring safety can reduce aggression. In this rotation, A is correct. Question 3. The dorsal recumbent position is: Option A, lying on the back with knees bent and feet flat on the bed. Option B, lying on the stomach. Option C, sitting straight up. Option D, lying on the side. The correct answer is option B, lying on the stomach. Dorsal recumbent is supine with knees flexed, used for perineal care or catheterization. In this rotation, B is correct. Question 4. The CNA is transferring a resident from bed to chair. The resident begins to fall. The CNA should: Option A, try to hold the resident up and call for help. Option B, ease the resident to the floor while protecting the head. Option C, step away to avoid injury. Option D, pull the resident back up quickly. The correct answer is option A, try to hold the resident up and call for help. If a fall is inevitable, guide the resident down and protect the head. In this rotation, A is correct. Question 5. A resident who is continent but needs assistance getting to the bathroom should be toileted. Option A, on a fixed schedule, such as every 2 hours and when requested. Option B, only when the resident calls. Option C, once per shift. Option D, after meals only. The correct answer is option C, once per shift. Scheduled toileting prevents incontinence episodes and maintains dignity. In this rotation, C is correct. Question 6. The chain of infection includes all of the following except: Option A, infectious agent. Option B, portal of exit. Option C, mode of transmission. Option D, health insurance status. The correct answer is option B, portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 7. The abbreviation PRN means: Option A, every day. Option B, as needed. Option C, before meals. Option D, at bedtime. The correct answer is option C, before meals. PRN, pro re nata, means medication or treatment is given only when needed. In this rotation, C is correct. Question 8. A resident with dementia repeatedly asks the same question. The CNA should: Option A, ignore the resident after the first answer. Option B, answer patiently each time using simple words, then redirect. Option C, tell the resident they already asked that. Option D, walk away. The correct answer is option C, tell the resident they already asked that. Patient's inconsistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 9. A resident with a fecal impaction may have: Option A, frequent, unformed bowel movements. Option B, liquid stool seeping around a hard mass in the rectum. Option C, no bowel symptoms. Option D, dark, tarry stools only. The correct answer is option D, dark, tarry stools only. Liquid stool seeping around an impaction can be mistaken for diarrhea. In this rotation, D is correct. Question 10. A resident is on a low-sodium diet. Which condiment is most appropriate? Option A, soy sauce. Option B, garlic powder or herbs. Option C, table salt. Option D, ketchup. The correct answer is option A, soy sauce. Herbs and salt-free seasonings add flavor without sodium. In this rotation, A is correct. Question 11. The CNA notices a resident's call light cord is tangled and out of reach. The CNA should: Option A, wait until the resident needs it to fix it. Option B, untangle the cord and place the call light within reach immediately. Option C, tell the resident to fix it themselves. Option D, report to maintenance. The correct answer is option D, report to maintenance. Ensuring call light accessibility is a fundamental safety measure. In this rotation, D is correct. Question 12. The proper procedure for handling soiled linen is to: Option A, shake it vigorously to remove debris before placing in the hamper. Option B, hold it against the CNA's uniform while transporting. Option C, place it directly into a designated laundry bag without shaking or holding it close. Option D, place it on the floor until transport is available. The correct answer is option A, shake it vigorously to remove debris before placing in the hamper. Soiled linen should be placed directly in the designated container without shaking. In this rotation, A is correct. Question 13. A resident with anxiety may exhibit: Option A, calm and relaxed demeanor. Option B, restlessness, pacing, rapid speech, and sweating. Option C, increased appetite. Option D, deep, slow breathing. The correct answer is option C, increased appetite. Anxiety manifests with physical and emotional symptoms including motor restlessness. In this rotation, C is correct. Question 14. A resident is on a low cholesterol diet. The CNA should avoid offering: Option A, baked skinless chicken breast. Option B, steamed vegetables. Option C, fried eggs with bacon. Option D, fresh fruit. The correct answer is option C, fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 15. The CNA is providing oral care to a resident with dentures. The dentures should be stored: Option A, in hot water. Option B, in a labeled container with cool water or denture solution. Option C, wrapped in a paper towel. Option D, on the bedside table. The correct answer is option C, wrapped in a paper towel. Dentures should be stored in a labeled container with water to prevent warping and loss. In this rotation, C is correct. Question 16. After providing perineal care, the CNA should: Option A, leave the resident in a wet bed for a few minutes. Option B, ensure the resident is dry, positioned comfortably, and call light is within reach. Option C, move to the next resident immediately. Option D, apply powder liberally. The correct answer is option D, apply powder liberally. Ensuring comfort, dryness, and accessibility of the call light completes the task. In this rotation, D is correct. Question 17. When providing morning care, the CNA should encourage the resident to: Option A, stay in bed as long as possible. Option B, void, urinate, first, then participate in hygiene. Option C, skip breakfast for more sleep. Option D, wait for the nurse before doing anything. The correct answer is option C. Skip breakfast for more sleep. Voiding upon waking is a basic need. Encouraging participation promotes independence. In this rotation, C is correct. Question 18. When applying a hospital gown to a resident within 4, the CNA should: Option A, disconnect the 4 to thread the gown. Option B, put the gown on the arm with the 4 first, then the other arm. Option C, gather the gown on the tubing and thread it carefully without disconnecting the 4. Option D, cut the gown. The correct answer is option A. Disconnect the 4 to thread the gown. 4 lines should never be disconnected by a CNA. Gowns are threaded carefully over the tubing. In this rotation, A is correct. Question 19. When turning a resident onto their side, the CNA should place: Option A pillow under the resident's back only. Option B, a pillow between the knees and another supporting the back and top arm. Option C, the resident's top leg straight down on the mattress. Option D, no pillows for correct alignment. The correct answer is option A pillow under the resident's back only. Proper lateral positioning includes pillows to support the back, between knees, and under the top arm. In this rotation, A is correct. Question 20. The most comfortable position for a resident during foot care is: Option A, standing. Option B, sitting in a chair with feet supported or soaking in a basin placed securely. Option C, lying flat. Option D, with legs crossed. The correct answer is option D, with legs crossed. A seated position with feet supported is comfortable and safe. In this rotation, D is correct. Question 21. A resident with a blood pressure of 170/95 mmHg should be: Option A, given medication by the CNA. Option B, reported to the nurse for evaluation. Option C, told to rest and rechecked in 24 hours. Option D, ignored if asymptomatic. The correct answer is option D, ignored if asymptomatic. Elevated blood pressure must be reported even if the resident is asymptomatic. In this rotation, D is correct. Question 22. When undressing a resident with one-sided weakness, the CNA should remove the garment from: Option A, the weak side first. Option B, the strong side first. Option C, the head first. Option D, the feet first. The correct answer is option B, the strong side first. The garment is removed from the strong side first, then the weak side. Question 23. The CNA is assisting a resident with breakfast. The resident suddenly clutches their throat and cannot speak. The CNA should: Option A, give the resident water. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, call 911 and wait. Option D, slap the resident on the back. The correct answer is option C, call 911 and wait. Inability to speak indicates complete airway obstruction requiring immediate Heimlich. In this rotation, C is correct. Question 24. Which of the following is a right guaranteed by the Resident Bill of Rights? Option A, the right to choose their own room number. Option B, the right to be free from physical and chemical restraints used for discipline. Option C, the right to free cable television. Option D, the right to unlimited visiting hours. The correct answer is option D, the right to unlimited visiting hours. Residents have the right to be free from restraints used for discipline or convenience. In this rotation, D is correct. Question 25. The CNA is assisting a resident with a walker. The resident should be instructed to: Option A, push the walker far ahead and step to it. Option B, move the walker a short distance forward and step into it. Option C. Lift the walker completely with each step. Option D. Lean heavily on the back of the walker. The correct answer is option C. Lift the walker completely with each step. Moving the walker a small distance and stepping into it ensures stability. In this rotation, C is correct. Question 26. Oxygen is in use in a resident's room. The CNA should ensure that Option A. Smoking is permitted in the room. Option B. No smoking signs are posted, and electrical equipment is checked for sparks. Option C. The oxygen flow is turned off when visitors arrive. Option D. The resident is left unattended frequently. The correct answer is option D. The resident is left unattended frequently. Oxygen supports combustion. All ignition sources must be eliminated. In this rotation, D is correct. Question 27. A hand roll is used to Option A. Restrain the resident's hands. Option B. Keep the fingers and thumb in a functional position, preventing contractures. Option C. Allow the resident to exercise hand muscles. Option D. Keep the wrist straight for therapy. The correct answer is option D. Keep the wrist straight for therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 28. A resident is scheduled for a shower but states, "I am too tired today." The CNA should Option A. Insist the resident must shower. Option B. Respect the refusal, report to the nurse, and offer a partial bath or reschedule. Option C. Bathe the resident in bed against their will. Option D. Document that the resident is uncooperative. The correct answer is option B. Respect the refusal, report to the nurse, and offer a partial bath or reschedule. Residents have the right to refuse care. Alternatives can be offered. Question 29. Subjective data includes Option A. Temperature reading of 101.2 degrees Fahrenheit. Option B. A bruise on the right forearm. Option C. Respiratory rate of 22 breaths per minute. Option D. I feel nauseous, stated by the resident. The correct answer is option A. Temperature reading of 101.2 degrees Fahrenheit. Subjective data, symptoms, are things the resident reports feeling. In this rotation, A is correct. Question 30. A resident who has experienced a traumatic event may re-experience it through Option A. Laughter. Option B. Flashbacks, nightmares, or intrusive thoughts. Option C. Increased appetite. Option D. Deep sleep. The correct answer is option B. Flashbacks, nightmares, or intrusive thoughts. Re-experiencing trauma is a hallmark symptom of post-traumatic stress disorder. Question 31. The best way to ensure an accurate intake record is to Option A. Estimate how much the resident drank. Option B. Measure fluids in milliliters, ml, and document immediately. Option C. Ask the resident how much they drank. Option D. Document at the end of the shift from memory. The correct answer is option C. Ask the resident how much they drank. Immediate, accurate measurement and documentation ensure reliable data. In this rotation, C is correct. Question 32. An apical pulse is taken. Option A. At the wrist. Option B. At the neck. Option C. By auscultating over the apex of the heart with a stethoscope. Option D. Behind the knee. The correct answer is option A. At the wrist. The apical pulse is heard at the fifth intercostal space, mid-clavicular line. In this rotation, A is correct. Question 33. A transfer belt is applied. Option A. Over bare skin for a secure grip. Option B. Over clothing, snugly around the waist. Option C. Under the arms. Option D, around the neck. The correct answer is option B. Overclothing, snugly around the waist. A gait belt is worn over clothing and tightened securely around the waist. Question 34. Catastrophic reactions in dementia refer to. Option A, natural disasters. Option B, an extreme emotional outburst to a seemingly minor stressor. Option C, calm, rational responses. Option D, the resident's favorite activity. The correct answer is option A, natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 35. If a resident is found unconscious on the floor, the CNA should first. Option A, call for help and check for responsiveness and breathing. Option B, put a pillow under the resident's head. Option C, lift the resident into bed immediately. Option D, run to the nurse's station. The correct answer is option B. Put a pillow under the resident's head. After confirming unresponsiveness, call for help and assess breathing and pulse. Do not move with potential injury. In this rotation, B is correct. Question 36. When shaving a resident with a safety razor, the CNA should. Option A, shave against the direction of hair growth. Option B, soften the beard with warm water, apply shaving cream, and shave in the direction of hair growth. Option C, use no cream to see the hair better. Option D, shave dry skin for efficiency. The correct answer is option B. Soften the beard with warm water, apply shaving cream, and shave in the direction of hair growth. Preparing the skin softens hair. Shaving with the grain reduces irritation. Question 37. The term nosocomial infection refers to an infection. Option A, acquired in the community. Option B, acquired in a healthcare facility. Option C, caused by a virus. Option D, that is not treatable. The correct answer is option B. Acquired in a healthcare facility. Nosocomial, healthcare associated, infections are acquired during the course of receiving healthcare. Question 38. The CNA has an ethical responsibility to report which of the following? Option A, coworker taking an extended lunch break. Option B, a coworker observed verbally abusing a resident. Option C, the charge nurse arriving late. Option D, the kitchen running out of a dessert item. The correct answer is option D, the kitchen running out of a dessert item. Resident abuse must be reported immediately. In this rotation, D is correct. Question 39. When feeding a resident who is visually impaired, the CNA can use the clock method, which involves Option A, telling the time every few minutes. Option B, describing the location of food on the plate using clock positions. Option C, setting a timer for meal duration. Option D, feeding the resident as fast as possible. The correct answer is option D, feeding the resident as fast as possible. The clock method helps visually impaired residents locate food independently. In this rotation, D is correct. Question 40. A resident is being discharged. The CNA should. Option A, rush the resident out to prepare for the next admission. Option B, help the resident gather belongings and provide emotional support. Option C, tell the resident they cannot return. Option D, ignore the resident's anxiety about leaving. The correct answer is option A. Rush the resident out to prepare for the next admission. Discharge can be stressful. Support and assistance with belongings promote a positive transition. In this rotation, A is correct. Question 41. A resident is wandering toward an exit. The best intervention is to Option A, physically block the door and tell the resident to go back. Option B, gently redirect the resident to a safe area and engage in meaningful activity. Option C. Apply restraints immediately. Option D. Shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 42. After bathing, the water should be discarded. Option A. In the sink in the resident's room. Option B. In the designated dirty utility room hopper or sluice. Option C. On the floor of the shower room. Option D. Out the window. The correct answer is option C. On the floor of the shower room. Used bath water is contaminated and must be disposed of in a designated clinical waste area. In this rotation, C is correct. Question 43. A suppository is administered rectally. In what position should the resident be placed? Option A. Supine. Option B. Left lateral, Sims, position. Option C. Prone. Option D. Standing. The correct answer is option D. Standing. The left lateral Sims position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 44. The Trendelenburg position is when? Option A. The head of the bed is elevated. Option B. The foot of the bed is elevated, and the head is lowered. Option C. The bed is flat. Option D. The resident is sitting straight up. The correct answer is option C. The bed is flat. Trendelenburg involves tilting the bed so the head is lower than the feet. In this rotation, C is correct. Question 45. A resident tells the CNA, "I am worthless and no one cares about me." An appropriate therapeutic response is: Option A. That's not true, everyone loves you. Option B. Why would you say that? Option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Option D. You shouldn't feel that way. The correct answer is option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Empathetic, validating statements. Open communication. Avoid dismissing feelings or giving false reassurance. Question 46. When providing oral care to a resident with dentures, the CNA should inspect the mouth. Option A. Only if the resident complains of pain. Option B. At the time of denture removal and cleaning. Option C. Once a year. Option D. Only by looking at the teeth. The correct answer is option D. Only by looking at the teeth. Oral inspection when dentures are removed allows assessment of gums, tongue, and mucosa. In this rotation, D is correct. Question 47. A draw sheet is used to: Option A. Cover the resident for warmth. Option B. Reposition a resident in bed without causing friction or shearing. Option C. Draw blood. Option D. Record intake and output. The correct answer is option B. Reposition a resident in bed without causing friction or shearing. A draw sheet assists with turning and repositioning, reducing friction and shearing forces. Question 48. An example of objective data is: Option A. The resident feels sad today. Option B. The resident's blood pressure is 140/90 mmHg. Option C. The resident says they have a headache. Option D. The resident's family thinks they look pale. The correct answer is option D. The resident's family thinks they look pale. Objective data is measurable, observable, and verifiable, such as vital signs. In this rotation, D is correct. Question 49. When counting respirations, the CNA should: Option A. Tell the resident to breathe normally while counting. Option B. Count respirations while pretending to still be taking the pulse. Option C. Count only after informing the resident. Option D. Ask the resident to hold their breath. The correct answer is option C. Count only after informing the resident. If the resident is aware, they may alter their breathing. Counting without the resident's awareness yields a more accurate rate. In this rotation, C is correct. Question 50. The purpose of a daily partial bath is to: Option A. Wash the face, hands, axilla, and perineal area for residents who cannot tolerate a full bath. Option B. Fully bathe the resident. Option C. Wash only the feet. Option D. Provide recreational activity. The correct answer is option D. Provide recreational activity. A partial bath focuses on areas prone to odor and moisture. In this rotation, D is correct. Question 51. The dorsalis pedis pulse is found: Option A. At the wrist. Option B. Behind the knee. Option C. On the top of the foot. Option D. At the temple. The correct answer is option D. At the temple. The dorsalis pedis artery runs along the top of the foot. In this rotation, D is correct. Question 52. A resident with emphysema should be positioned in: Option A. Supine position. Option B. High Fowler's or orthopneic position. Option C. Prone position. Option D. Trendelenburg. The correct answer is option B. High Fowler's or orthopneic position. Upright positioning facilitates lung expansion and eases breathing. Question 53. A resident who is incontinent of urine must have perineal care. Option A. At the end of the shift. Option B. Immediately after each episode of incontinence. Option C. Once daily. Option D. Only during the scheduled bath. The correct answer is option C. Once daily. Urine is irritating to the skin. Prompt cleaning prevents skin breakdown. In this rotation, C is correct. Question 54. A resident who speaks only Spanish is admitted. The best method of communication is: Option A. Speaking loudly in English. Option B. Using a professional interpreter or translation services. Option C. Using family members as the primary translators. Option D. Using gestures only. The correct answer is option C. Using family members as the primary translators. Professional interpretation ensures accuracy and confidentiality. Family members may have emotional bias. In this rotation, C is correct. Question 55. When two tasks need to be done at the same time, the CNA should prioritize based on: Option A. Which resident is the most demanding? Option B. The urgency of the situation, prioritizing life-threatening emergencies first. Option C. Which task is easiest to complete? Option D. The CNA's personal preference. The correct answer is option C. Which task is easiest to complete? Prioritization is based on clinical urgency. Emergencies always come first. In this rotation, C is correct. Question 56. The most common site for taking an adult pulse is the: Option A. Carotid artery. Option B. Brachial artery. Option C. Radial artery. Option D. Femoral artery. The correct answer is option D. Femoral artery. The radial artery at the wrist is the most accessible and commonly used site. In this rotation, D is correct. Question 57. The best approach when a resident is crying is to: Option A. Tell the resident not to cry. Option B. Sit with the resident, offer a tissue, and provide a quiet, supportive presence. Option C. Leave the room to provide privacy. Option D. Change the subject immediately. The correct answer is option B. Sit with the resident, offer a tissue, and provide a quiet, supportive presence. Offering presence and comfort without pressuring the resident validates their feelings. Question 58. When removing PPE, the gloves should be removed first because: Option A. They are the most expensive. Option B. They are considered the most contaminated. Option C. They are the easiest to remove. Option D. It does not matter what order is used. The correct answer is option B. They are considered the most contaminated. Gloves are the most contaminated piece of PPE and should be removed first to prevent contamination during removal. Question 59. Which of the following is considered a physical restraint? Option A. A bed in the lowest position. Option B. A bedside commode. Option C. A vest restraint or side rails that prevent a resident from voluntarily getting out of bed. Option D. A walker. The correct answer is option D. A walker. Physical restraints are devices that restrict freedom of movement. Side rails used to prevent voluntary bed exit are restraints. In this rotation, D is correct. Question 60. A fracture pan is used for residents who: Option A. Are obese. Option B. Have a hip fracture, spinal injury, or cannot raise their hips. Option C. Prefer it over a regular bedpan. Option D. Are in isolation. The correct answer is option C. Prefer it over a regular bedpan. The fracture pan's flat, tapered design allows minimal movement of the resident's hips and spine. In this rotation, C is correct. Question 61. When a resident is admitted, the CNA should: Option A. Leave the resident alone to explore the room. Option B. Orient the resident to the room, call light and emergency procedures. Option C. Complete all paperwork before greeting the resident. Option D. Tell the resident to read the admission packet. The correct answer is option B. Orient the resident to the room, call light and emergency procedures. Orientation to the environment promotes safety and reduces anxiety. Question 62. A resident is terminally ill and asks the CNA, "Am I going to die?" The CNA's best response is: Option A. No, you're going to be fine. Option B. I don't know, but I will ask the nurse to come talk with you. Option C. We all die someday. Option D. Ignore the question and change the subject. The correct answer is option B. I don't know, but I will ask the nurse to come talk with you. The CNA should not provide medical prognosis. Referring to the nurse while acknowledging concern is appropriate. Question 63. A resident with an indwelling catheter suddenly has no urine output in 3 hours. The CNA should first: Option A. Remove and replace the catheter. Option B. Check for kinks in the tubing and ensure the drainage bag is below the bladder. Option C. Irrigate the catheter. Option D. Wait another hour. The correct answer is option C. Irrigate the catheter. Mechanical obstruction is a common cause. Checking for kinks is the first step, then report. In this rotation, C is correct. Question 64. A resident with aphasia has difficulty: Option A. Walking. Option B. Communicating verbally or understanding language. Option C. Swallowing. Option D. Seeing. The correct answer is option B. Communicating verbally or understanding language. Aphasia is a communication disorder resulting from brain damage that affects the ability to speak, understand speech, read, or write. Question 65. The most important factor in communicating with a resident who has had a stroke affecting speech is: Option A. Patience in allowing ample time for the resident to respond. Option B. Speaking very loudly. Option C. Finishing the resident's sentences. Option D. Using only written communication. The correct answer is option A. Patience in allowing ample time for the resident to respond. Patience demonstrates respect and reduces pressure. Rushing increases frustration. Question 66. A walker is properly fitted when the resident's hands rest on the grips and the elbows are: Option A, fully extended. Option B, flexed at a 15 to 30 degree angle. Option C, bent at 90 degrees. Option D, held above the shoulder level. The correct answer is option A, fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 67. A CNA is emptying a urinary drainage bag. The CNA should: Option A, use the same container for all residents. Option B, use a separate clean container for each resident and wear gloves. Option C, empty the bag without gloves. Option D, let the drain tube touch the collection container. The correct answer is option D, let the drain tube touch the collection container. Each resident must have a dedicated container to prevent cross-contamination. In this rotation, D is correct. Question 68. The proper sequence for donning personal protective equipment, PPE, is: Option A, gloves, gown, mask. Option B, mask, gown, gloves. Option C, gown, mask, gloves. Option D, mask, gloves, gown. The correct answer is option A, gloves, gown, mask. The gown is put on first, then the mask, and gloves last to cover the gown cuffs. In this rotation, A is correct. Question 69. A resident who has had a hip replacement should avoid: Option A, sleeping on the back. Option B, crossing the legs at the knees or ankles. Option C, using an abduction pillow. Option D, sitting in a high chair. The correct answer is option B, crossing the legs at the knees or ankles. Crossing legs, bending hip more than 90 degrees, and twisting are common post-op hip precautions. Question 70. The CNA is about to transfer a resident from bed to wheelchair. The first safety step is to: Option A, unlock the wheels of both the bed and wheelchair. Option B, lock the wheels of the wheelchair only. Option C, lock the wheels of both the bed and the wheelchair. Option D, ask the resident to stand on the bed. The correct answer is option B, lock the wheels of the wheelchair only. Both the bed and wheelchair must have locked wheels for a safe transfer. In this rotation, B is correct. Question 71. Proper body mechanics include all of the following except: Option A, keeping the back straight. Option B, lifting with the legs. Option C, twisting at the waist when turning. Option D, holding objects close to the body. The correct answer is option C, twisting at the waist when turning. Twisting at the waist increases the risk of back injury. The entire body should turn. Question 72. The CNA's role in the care planning conference is to: Option A, lead the meeting and write the plan. Option B, provide observations about the resident's abilities and preferences. Option C, prescribe new treatments. Option D, set discharge dates. The correct answer is option D, set discharge dates. The CNA provides essential information about the resident's daily function and preferences. In this rotation, D is correct. Question 73. To effectively communicate with a resident who has a visual impairment, the CNA should: Option A, avoid speaking unless necessary. Option B, identify themselves when entering the room and explain procedures. Option C, turn off all lights. Option D, speak only to the family member present. The correct answer is option A, avoid speaking unless necessary. Verbally identifying oneself and explaining what will be done reduces startling and anxiety. In this rotation, A is correct. Question 74. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is Option A 15:2, Option B 30:2, Option C 50:2, Option D 100:2. The correct answer is Option D, 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 75. A resident repeatedly asks to go home. The best response is Option A, you are home now. Option B, you can never go home. Option C, tell me about your home. Option D, ignore the request as it is not reasonable. The correct answer is Option D, ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 76. The CNA is providing catheter care. The correct procedure includes Option A, using the same washcloth for the entire perineal area. Option B, cleaning away from the meatus, from clean to dirty. Option C, cleaning from the meatus outward, from clean to dirty. Option D, using alcohol to clean the insertion site. The correct answer is Option D, using alcohol to clean the insertion site. Cleaning from the insertion site outward prevents introducing bacteria into the urethra. In this rotation, D is correct. Question 77. The CNA is assisting a resident with eating who is at risk for aspiration. Which action is correct? Option A, encourage drinking liquids between bites of solid food. Option B, place the resident upright and offer small bites at a slow pace. Option C, feed the resident while reclining. Option D, give large spoonfuls to speed up the process. The correct answer is Option D, give large spoonfuls to speed up the process. Upright positioning with small bites minimizes aspiration risk. In this rotation, D is correct. Question 78. The minimum data set, MDS, is Option A medication administration record. Option B, a comprehensive assessment tool used to plan resident care. Option C, a list of residents' dietary preferences. Option D, the facility's financial report. The correct answer is Option B, a comprehensive assessment tool used to plan resident care. The MDS is a federally mandated assessment instrument used to evaluate a resident's functional capabilities. Question 79. When should a CNA wash their hands? Option A, only when visibly soiled. Option B, before and after resident contact, after removing gloves, and after contact with body fluids. Option C, only at the beginning of the shift. Option D, only after using the restroom. The correct answer is Option D, only after using the restroom. Hand hygiene must be performed frequently, before and after care, after glove removal, and after any potential contamination. In this rotation, D is correct. Question 80. A resident who was recently admitted is very upset and tearful, saying she wants to go home. The best response is Option A, you are here now, so get used to it. Option B, this is your home now. You cannot leave. Option C, I can see you are upset. Adjusting is hard. I am here to listen. Option D, I'll call your family to take you home. The correct answer is Option D, I'll call your family to take you home. Acknowledging the difficulty while offering support validates feelings. In this rotation, D is correct. Question 81. A resident has an irregular pulse. The CNA should count the pulse for Option A 15 seconds and multiply by 4. Option B 30 seconds and multiply by 2. Option C, A full 60 seconds. Option D. Only until the irregularity is detected. The correct answer is option C. A full 60 seconds. An irregular pulse should be counted for a full minute to accurately assess rate and rhythm. Question 82. The abbreviation HOB means. Option A, head of bed. Option B, hands on back. Option C, hold on bed rest. Option D, history of bleeding. The correct answer is option D. History of bleeding. HOB is used in positioning orders. In this rotation, D is correct. Question 83. The resident's weight is measured as 150 pounds. The CNA should document. Option A, 150 pounds only. Option B, 150 kilograms. Option C, 150 pounds and record in kilograms if the facility uses metric. Option D, 15.0 pounds. The correct answer is option D. 15.0 pounds. Many facilities use metric. Follow facility protocol, which may involve converting to kilograms. In this rotation, D is correct. Question 84. To support a resident's spiritual needs, the CNA should. Option A, impose their own beliefs. Option B, respect the resident's beliefs and facilitate access to spiritual resources. Option C, tell the resident that spirituality is not important. Option D, avoid discussing spiritual topics. The correct answer is option D. Avoid discussing spiritual topics. Spiritual care is part of holistic care. Respecting beliefs supports well-being. In this rotation, D is correct. Question 85. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because. Option A, alcohol-based rubs are too expensive. Option B, soap and water is faster. Option C, alcohol is not effective against C. diff spores. Option D, soap is more gentle on the skin. The correct answer is option A. Alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 86. The CNA is recording intake. Which of the following is not counted as fluid intake? Option A, ice cream. Option B, gelatin, Jell-O. Option C, pudding. Option D, soup. The correct answer is option B. Gelatin, Jell-O. Items liquid at room temperature are counted. Pudding remains semi-solid. In this rotation, B is correct. Question 87. Rigor mortis is the. Option A, relaxation of muscles after death. Option B, stiffening of the body's muscles several hours after death. Option C, cooling of the body after death. Option D, pooling of blood after death. The correct answer is option B. Stiffening of the body's muscles several hours after death. Rigor mortis is the temporary stiffening beginning about 2 to 4 hours after death. Question 88. When a CNA witnesses a coworker ignoring a resident's call light repeatedly, the CNA should. Option A, ignore it to avoid conflict. Option B, report the behavior to the charge nurse. Option C, confront the coworker aggressively. Option D, tell the resident to complain. The correct answer is option D. Tell the resident to complain. Neglect of residents must be reported through proper channels. In this rotation, D is correct. Question 89. The CNA is measuring a resident's height. The resident is unable to stand. The CNA should. Option A, document unable to measure. Option B, measure the resident lying flat using a tape measure. Option C, estimate the height. Option D, use the last recorded height. The correct answer is option A. Document unable to measure. A resident who cannot stand can be measured in bed using a tape measure. In this rotation, A is correct. Question 90. When caring for a resident with paranoid ideation, the CNA should: Option A, argue with the resident about the false belief. Option B, acknowledge feelings without reinforcing the delusion and provide a calm environment. Option C, joke with the resident to lighten the mood. Option D, isolate the resident from others. The correct answer is option D. Isolate the resident from others. Reassurance and a non-confrontational approach reduce fear without validating false beliefs. In this rotation, D is correct. Question 91. A resident is at risk for aspiration. The CNA should check the resident's mouth after eating to: Option A, ensure no food is left over for later. Option B, check for pocketing of food in the cheeks. Option C, administer mouthwash. Option D, count the number of chews. The correct answer is option A. Ensure no food is left over for later. Pocketing poses an aspiration risk. The mouth must be cleared after each meal. In this rotation, A is correct. Question 92. Which of the following is considered a normal oral temperature? Option A, 96.0 degrees Fahrenheit, 35.6 degrees Celsius. Option B, 98.6 degrees Fahrenheit, 37.0 degrees Celsius. Option C, 100.2 degrees Fahrenheit, 37.9 degrees Celsius. Option D, 102.0 degrees Fahrenheit, 38.9 degrees Celsius. The correct answer is option C. 100.2 degrees Fahrenheit, 37.9 degrees Celsius. 98.6 degrees Fahrenheit, 37 degrees Celsius, is the average normal oral temperature. In this rotation, C is correct. Question 93. The abbreviation NPO means: Option A, no pain observed. Option B, nothing by mouth. Option C, normal post-operative. Option D, no physical orders. The correct answer is option C, normal post-operative. NPO means nil per os, nothing by mouth. In this rotation, C is correct. Question 94. A resident who is at risk for falls should have: Option A, the bed in the highest position for ease of care. Option B, the call light placed out of reach to prevent overuse. Option C, the bed in the lowest position, call light within reach, and clutter-free pathways. Option D, restraints applied at all times. The correct answer is option C, the bed in the lowest position, call light within reach, and clutter-free pathways. Fall prevention includes low bed position, accessible call light, and clear environment. Question 95. The CNA is in a resident's room when the resident begins to choke and cannot cough, speak, or breathe. The CNA should: Option A, leave to find the nurse. Option B, call for help and begin abdominal thrusts, Heimlich maneuver. Option C, give the resident a drink of water. Option D, slap the resident on the back. The correct answer is option B, call for help and begin abdominal thrusts, Heimlich maneuver. Complete airway obstruction requires immediate intervention. Question 96. A resident with an indwelling catheter has the drainage bag positioned above the bladder. The CNA should: Option A, leave it as is for convenience. Option B, lower the bag below the level of the bladder immediately. Option C, raise it higher to promote drainage. Option D, remove the catheter. The correct answer is option C, raise it higher to promote drainage. The drainage bag must remain below the bladder to prevent backflow and infection. In this rotation, C is correct. Question 97. Validation therapy is used primarily for residents with: Option A, acute pain. Option B, dementia, by acknowledging their feelings and memories. Option C, hearing loss. Option D, physical disabilities. The correct answer is option A. Acute pain. Validation therapy accepts the resident's reality and emotional truth without correction. In this rotation, A is correct. Question 98. Proper alignment when sitting in a chair includes: Option A, legs crossed at the knees. Option B, feet flat on the floor or wheelchair footrests, hips and knees at 90 degrees. Option C, slumped forward over a table. Option D, one hip higher than the other. The correct answer is option A. Legs crossed at the knees. Proper seated alignment promotes circulation and comfort. In this rotation, A is correct. Question 99. The first step when a CNA is exposed to a resident's blood via needle stick is to: Option A, complete an incident report. Option B, wash the site with soap and water and report to the supervisor immediately. Option C, ignore it if it's a small wound. Option D, apply a bandage and continue working. The correct answer is option B. Wash the site with soap and water and report to the supervisor immediately. Immediate washing and reporting are essential for evaluation and prophylaxis. Question 100. The best way for a CNA to maintain professional growth is to: Option A, never attend educational programs. Option B, participate in continuing education and stay updated on best practices. Option C, rely solely on initial training. Option D, ignore changes in healthcare. The correct answer is option A. Never attend educational programs. Healthcare is constantly evolving. Continuing education ensures safe, current care. In this rotation, A is correct.